It's another Wednesday with your fertility specialist, and I'm excited to be your host this afternoon. I'm Ruth Ogogo, and on behalf of Alps Hospitals, we love to say a very big thank you to our viewers. Thank you for liking our post. Thank you for sharing, and yes, it's always good to be with you guys every Wednesday. It's a day with your fertility specialist, so we are bringing back to the table fertility issues. Matters are not ending, so we want to continue from where we stopped in our last live session. So right now, as we get started, please share this link with someone, call up someone. If you need to send it out to someone, please do that right now. But make sure that you're inviting someone to be a part of this show right now. And to deal with these matters arising, these matters that are never ending, we have a special guest with us. His name is Dr. Kenneth Eguda. Dr. Kenneth, it's good to have you.
I'm not a special guest.
Oh
I'm
yes.
a regular guest. Yeah.
It's good to have you with us, Dr.
Oh,
Ken.
nice to hear that.
Yes, so dear viewers, for someone watching for the first time, it might interest you to know that Dr. Ken is a consultant gynecologist. He's a minimal access surgeon. He's a fertility specialist and a very, very good IVF specialist. He's also the first to have had laser gynecology brought into West Africa. Like more, all I'm saying is he pioneered it into West Africa, laser gynecological surgeries. So it's good to have you, Dr. Ken.
You mean Africa, actually?
Oh, but yes, so Africa, I beg your pardon on that. So yes, Africa. Wow, that's a lot. That's more like African continent. Oh wow. So it's good to have you, Dr. Ken.
Thanks.
Okay, so viewers, as we get started, feel free to drop your thoughts, your comments, your questions into the comment section, and we'll definitely attend to them appropriately. But right now, let's deal with some questions that people have asked from our last session. Okay, so before we even get into matters arising, yes, this trend online. I know we lost, or yes, news has it that we lost one of the influencers on TikTok. I think Vivian Chinelo. Yes, Vivian Chinelo. I think she's known as Big Bots something. Yes, something like that.
Big but fit.
Okay, Big Bot Fit. Yes. So we saw that it's really trending, and first of all, based on news that we have, it's sad to say that we lost such a good influencer on TikTok, her moves and all, and we really hope that she rests in peace wherever she is. But a lot of rumors have actually been trending with regards to the cause of her death. I know I saw some parts where they said she went for a tummy tuck surgery. Some said maybe it's a fibroid surgery, wondering why her tummy. And because I know a lot of people have talked about her tummy and how she dances with such a big tummy and all that. Some even said it's hernia. So it's worrisome. Can just a TikTok can just a tummy tuck surgery just result to that? I mean, what's your opinion about this whole trends about her death and all? Of course, I know you were not there, but just to seek your what you think about all that is trending.
Yeah, she's a very lively person.
Mm,
I think I've seen clips of her dancing with her two boys,
mm,
and she, for her age, almost 50 or thereabout, dancing the way she does with that amount of energy
energy,
can only
yeah,
leave nothing but admiration.
yeah.
I'm not sure she's dead,
Mm,
and I wish her long life, because it's still rumors, rumors. Some rumors say she has passed. Some other
mm.
rumors is like she's still alive,
We were not.
um, but I don't know. I really wish and pray that she's alive wherever
Mm,
she is and that she is in good condition or good state. But with respect to body shaming her,
mm,
it's something I think shouldn't be done publicly,
yeah.
and shouldn't even be done.
Mm,
If you're worried about her, you call her, tell her that this should be adjusted, this should be done, this should be done. But in any case, there were rumors that she was battling a whole lot of things, as you said.
yeah.
One thing we know about about those in show business. And for that, dancing on the social media is a show business because
Yes.
if we know what it is, it's show business.
Mm.
You're concerned about
How you
your
look.
look, your
Yes.
looks, your physique, and your shape, your statues,
Yes.
and having that big tummy can actually be worrisome,
Mm.
because if people talk about it, no matter how carefree you think you are, it gets to you at some point in
Yes,
time,
that's true.
and there's nothing wrong in fixing it.
Mm.
Yeah, nothing wrong in fixing it. But looking at it from a gynecological perspective, for me, I see a lot of women with big tummy, those who have delivered number of babies have big sagging tummy, anterior abdominal wall. And those having growths, for instance,
Yeah.
fibroids, adenomyosis, and when fibroid or a mass grows from the pelvic upward into the abdominal cavity,
Mm.
it gives this bulging anterior abdominal looks,
Look.
and mass of that size can actually be very heavy. Dancing
Mm.
with it can actually be very uncomfortable.
Uncomfortable.
You
That's
understand? So
true.
fibroid does that, ovarian mass does that, adenomyosis does that. These are things that can grow from the pelvics,
Mm.
and it can be fixed. Sure, it can be fixed, and the way to fix it is to operate it. We
Mm.
do that all the time, and worst case scenario, you take out the uterus entirely.
Mm.
Just today, we took out one.
Mm. Wow.
You know, you take out the uterus,
Mm.
and if that is a cause of the bulging anterior abdominal wall, then that
Mm.
solves the problem.
Mm.
And if it is fibroid, for instance, or even adenomyosis, and she's still menstruating, then it's actually going to be a little bit of a problem, because it could make her have very heavy menses,
Mm.
and then you'll be battling anemia, lack of blood, and all
Mm.
of
All of
that.
that.
But that may not be what she has, because nobody actually knows. I
Exactly.
haven't talked with any doctor who managed that,
Mm.
and she's not known to me personally, apart from seeing
Yes.
her dance moves online.
Online. Yes.
You know, but then those who manage her may want to say something about it, if at all she was in a hospital
Mm. Yeah.
and she
Clear.
was attended to.
Yeah.
But in any case, if you have a fibroid that size, whether it gives you symptoms or not, and you are
Yes.
in show business, it should be attended to,
Mm.
irrespective of whether whether you're being insulted online or not. It
Mm.
should be
Yes.
attended to. But hernia could also cause that.
Mm.
I think you mentioned hernia.
Kenya. Yes, that was
Hernia
another.
just means some
Mm.
intestines, pushing their way through the anterior abdominal wall,
Oh. Mm.
so that just maybe the skin of the anterior abdominal wall just contain the intestines, in which case the
Yes.
anterior abdominal will be bulging too.
Mm.
That's not too heavy. You could be that agile and athletic with it, seeing the
Yeah.
way she danced, and to fix it is also straightforward. And if everything goes well, I mean, the surgery is usually a straightforward surgery,
Surgery.
and nothing should happen, you know. And even if you think about tummy talk, which is a surgery I personally like, you know, tummy talk, it's a superficial surgery, because you just
Mm.
put a probe through
Mm.
the anterior abdominal wall to the fat layer, an
Okay.
electric probe.
Mm.
We have a laser probe that can be
Okay.
used for that, okay?
Okay.
An electric probe, and it burns down the fat, melts it off,
Wow.
and
Wow.
sucks it out. So
Mm.
it's not a surgery that goes into the abdominal cavity, it's a
Cavity.
superficial
Wow.
surgery.
Mm.
Then after doing that, if you have excess skin, you could
Yes.
trim off excess skin so that
Okay.
everything looks tight and
Wow.
fitted.
Mm.
A bulging abdominal wall could just become as flat as possible,
Possible.
and
Wow.
probably have some packs
Mm.
with it. So
Yeah.
it's straightforward. It could be done to the arms,
Mm.
could be done to the thigh, and
Yeah.
wherever you want to take
Want
out
to do
fat.
that. Wow.
So these are not surgeries that should easily cost somebody's life. If life is involved in it, it could just be
Something went wrong.
maybe an aesthetic accident,
Mm.
because one may have to want to look at that.
Mm.
So for tummy talk, for instance, worst case you have is maybe unnecessary bleeding.
Mm.
Unnecessary bleeding if a woman is taking some blood thinning medication for any reasons before that, then you could have
Surgery.
unnecessary bleeding. But those are informations that you should get before
Prior to
planning to
surgery.
do that surgery. Then if it's a blood vessel that is broken,
Hmm.
then and the bleeding is much torrential, you open up the
Yeah.
skin and you take care of the bleeder, and then that fixes it. So saying somebody just died from any of these surgeries that
Procedure.
are supposed to be straightforward leaves a lot to be thought about, and that is why
Hmm.
it's still a rumor. But in
Yeah.
any case, I think I like body talks. I mean, tummy talks. I like plastic surgery a lot because forget about the show business. It's a very healthy procedure to do because when you take out unnecessary fat
Fat.
and skin, you improve your health.
Hmm.
For those who battle diabetes, for instance, that improve the sensitivity to their medication and
Hmm.
helps them have good control of their sugar.
Oh, wow.
You know, it helps you with hypertension. Because fat is fat, it's bad. And for those going in for fertility care, always ask them to lose weight. These are drastic way to lose weight and to burn down fat because
Yeah.
fat reduce your chances of getting pregnant. You could get pregnant, but miscarriages are higher, complications are higher, diabetes in pregnancy is
Same
higher,
here. Yes.
hypertension in pregnancy is higher. So these are things that people haven't come to terms with yet, but it is a very healthy procedure to do. So
Procedure.
if I'm a woman or even a guy and
Hmm.
I have that kind of tummy, man, I take it out.
Hmm.
Yeah, I burn down those fats. If exercise doesn't burn it down, I physically will burn it down with surgery.
Hmm. So, viewers, well, Dr. Ken has mentioned a lot. So, it means that if you fall into any of these categories that are being rumored to be a likely cause of her death, if she's really dead, you shouldn't be scared of attempting such surgeries once you are able to get a good place to access care. Even though sometimes there are some things that are out of control, you really cannot tell who might have an aesthetic accident,
Exactly. Well,
and also,
I've actually, I've been a surgeon for God knows how long now. Not too many years. Yeah, because maybe I'm still a bit young, but then I've been operating for quite a while. You minimal access surgery, open surgeries, and all of that. We've seen patient pass following surgeries, but it's a tough thing to imagine. You
yeah.
understand? The accidents can happen, but it happens usually with tough surgeries, and that is why a lot of precautions need to be taken for such surgeries to be done. And of course, do the surgeries in very good places that have a capacity to manage complications. Simple surgeries can become complicated surgeries.
Yes.
Especially when you're dealing with anesthesia and all of that.
Mm,
So it's painful, to lose a patient. It's
yes.
very, very
Mm,
painful.
can imagine.
Yeah. I wish I could see her so many more times
Times.
dancing and know that she's in good health.
She puts a lot
Yeah.
of smile on people's face. Even the way she dances, it makes you want to join her to dance. Like she gives
Exactly.
that
Exactly.
that vibe. And
Exactly. It's a
well,
very, very agile woman.
yeah, right now we really don't know what is true, but just in case it's really true, we hope that her family, her loved ones, and everyone finds condolence and everyone is
I actually heard a lot of
comforted.
people criticize tummy talk because of all of that. But
Yeah.
why are they singling out
A
tummy
lot of
talk?
comments were like, why
Tummy
did she
talk,
have
tummy
to?
talk, tummy
She would
talk.
have left it. But same people still criticize the tummy,
Exactly. There's nothing bad with doing tummy talk. If you're in the show business, do your tummy talk. And if it's arm talk, you want to call it a fat reduction surgery or weight reduction surgeries, they are beautiful surgeries to be done. You know, anything can cause complication. Car crash complication, people die.
Yeah.
Natural disasters complication, people die. Yeah, people die from surgeries too. And that shouldn't stop people from accessing tummy talks if they have to do it.
Even if not for sure, I don't think people that have such bodies that I don't think they are comfortable.
They are not
They are not
comfortable.
comfortable. So
They're not
even for the
comfortable.
comfort of their body,
Exactly.
if not for anything, you still have
Have you
years to
seen ladies
live.
tying this stuff?
when they wear their giddus to
You know,
just, oh my
they
goodness,
suck
yeah,
in
I know,
everything and
yeah.
I've seen pregnant women tying those things.
Hmm.
I won't stop them
It's
because they
a
choke
lot.
the babies. You know,
It's a
so
lot. So for
with the tummy
comfort,
tuck, you would do you fix all of that and you become good again, and then you get your vibe, your sting, your confidence, your steez, as you guys call it.
yeah.
It's a beautiful thing to do.
Well, yeah. So, viewers, well, I know that we're talking about fertility. Well, this is part of fertility because there are also some people that have such body structure, and it's because of one health condition or the other. So it was good that we actually talked about it a bit. Well, now let's get back to more matters arising.
The business, right?
Yeah, more like it. Okay, so we have a question. How does ovulatory dysfunction affect fertility? That's a question from one of the viewers from our
The
last
word itself,
session.
dysfunction, it's just how it affects it. If
Mm.
it's dysfunction, I mean fertility is dysfunction because a woman has to ovulate
Mm.
and the eggs needs to travel down the fallopian tubes
Yeah.
and get fertilized before getting implanted
Yeah.
in the uterine cavity. So if there's ovulatory dysfunction,
Mm.
which can happen when a woman has thyroid disorder or polycystic ovary, especially, that's the highest
Mm.
cause of ovulatory dysfunction. You
Dysfunction.
see them not menstruating for
Mm.
3 6 months. There is no way you
Wow.
ovulate when you
Mm.
don't menstruate. It's not easy to have an ovulation when you do not menstruate,
Menstruate.
and so you would not be able to achieve pregnancy.
Mm.
And a lot goes with those ovulatory dysfunction. Other systems may be involved, and so you need to see the doctor,
Mm.
understand the reason for the ovulatory dysfunction. And if you need to be induced to ovulate, you try that. That's the
Mm.
first thing to try. And you have an intercourse with your partner to achieve pregnancy if he has good sperms. And if your
Mm.
fallopian tubes are
So
open,
open. Mm.
so it can actually be a big challenge.
Okay, hope this addresses your question. So we have a question. The person said, "Have I've been hearing secondary and primary infertility. What does it really mean?" Because she was diagnosed with primary infertility 2 years ago.
Okay.
Well, as funny as it might sound, I guess it's really something that is bothersome and worrisome for her to have actually asked
Primary
this
infertility and
question.
secondary. How about tertiary infertility?
Okay, please.
Okay, so for the sake of media, primary infertility is infertility in primary school. Secondary
Basic.
infertility is infertility in secondary school. Oh man,
Okay.
a lot of definition in this world. So primary infertility means she has never been pregnant
Okay.
before
Hmm.
until she was discovered to have infertility.
Hmm.
So
Okay.
it is primary. It's not. She's never been pregnant at all.
Pregnant.
So
Okay.
that is why it's called primary
Primary.
infertility. It is
Okay.
main infertility. Secondary means she has been pregnant several,
Okay.
maybe once or twice or several times before, but now that she needs pregnancy
It's
or she
not
needs to
coming.
have babies, the pregnancy is not
Not
forthcoming.
forthcoming.
And
Okay.
so, because she has been pregnant before, it's called secondary
Secondary. Okay.
infertility.
So it means there's definitely something that is now happening that was not
Exactly, that wasn't
okay.
there before,
Okay.
so
Oh,
secondary
okay.
infertility.
Okay. So hope you're able to understand this for this person that
Mm.
asked this question, and then
In any case, their treatment may just be the same. Mm. It
okay.
doesn't mean because his primary is difficult or secondary is
Mm,
difficult, the treatment may just be the same.
same.
And it could be secondary and more difficult than primary, or it could
Yeah.
be primary more difficult than secondary. It all
Secondary.
depends on the cause of infertility. And of
Infertility.
course, you can't rule out the man from this business.
Mm, wow. Okay, so hope this answers your question. Just in case you need further clarification or you feel where you were seeing you didn't have proper understanding of what you're actually dealing with, maybe, just maybe, if you're not close to ALPS hospitals, you could actually book an online consultation to have proper consultation with the doctor, and you'll be attended to and you'll have a good understanding on how to go about dealing with the primary infertility that you were diagnosed with. Okay, so we have another question. Does having regular period mean a woman is fertile?
Yes, I deal with that all the time,
Hmm.
especially when you're dealing with advanced age women.
Hmm.
A woman would have run out of eggs and she's just perimenopausal and
Okay.
she's menstruating
Hmm.
every month.
Hmm.
And you tell her she doesn't have eggs.
Eggs. Hmm.
So I'm menstruating. And actually,
Hmm.
women actually think that menstruation means they are washing out the eggs that they didn't become pregnant. Yeah, at least from this part of the world, that's the vibe I get. But you could be menstruating
Yeah.
and not ovulating,
Hmm.
or you're ovulating and not having good quality eggs.
BTS.
So when you're getting towards the tail end of your reproductive life, this
Yeah.
is very common.
Hmm.
It's very common. Some women can even be menstruating 7 to 10 years towards their fertility. Towards the later end of fertility, and not having good eggs or not having
Wow.
eggs at all.
Wow.
Yes, that's true.
Hmm.
Then, if you have some other metabolic conditions or genetic conditions like polycystic ovaries, you could be having withdrawal bleed
Hmm.
in the name of menstruation,
Menstruation.
and
Wow.
then
Hmm.
not producing eggs at
At
all.
all. Hmm. That's really bad.
Exactly, because you see, the dynamics of menstruation for those having a polycystic ovary is slightly different. Menses for advanced polycystic ovary is not because they have ovulated and the body has had estrogen and had progesterone and then it's breaking down because no pregnancy.
Yeah.
But it's usually because they have had a lot of exposure,
Hmm.
long time exposure to estrogen
Oh wow.
and no progesterone. So the lining of the womb builds up so bulky and
Okay.
it breaks down
Hmm.
just following estrogen exposure,
Wow.
prolonged estrogen exposure. And then they could have a long time bleed or
Hmm.
annoying spots.
Okay.
And then they're not ovulating. And because of that,
Yes.
they also cannot get pregnant. So you
Wow.
could be or menstruating or having a show of blood and still not menstruate
Menstruate.
and still not
Ovulate.
ovulating,
Hmm.
in which case pregnancy may not happen.
Hmm.
And so you will need to see the doctor to understand what's
What's
happening and
happening?
give the befitting treatment for your condition.
Hmm.
Yeah, for some advanced age, they may need to have fertility care with what do you call it, with egg donation, and then for the younger ones, they could have other modalities of treatment for polycystic ovary to make them
Ovaries.
ovulate
Hmm.
in case pregnancy is their concern.
Concern.
Yeah.
Well, hope that answers your question. And then we have Giselle from TikTok. She's asking or is asking, what if a person is okay, like that's not having fertility issues,
Uh,
but they just want to do IVF because they want to have children at once.
yes, I've seen a couple of clients like this.
Okay.
Yeah, some of them want to go school, and then when they travel, they may not be able to make out time to attend to fertility matters,
Hmm.
and so they want to just go the shortest route,
Yeah.
having the babies, and get done with it,
With
then
it.
go to school or go to work and not
Mm,
have anything to worry
to-
about. It's okay. It's a modern life. These are years of social revolution. You need to
mm,
take your life in your hands,
mm.
because you may just go to school and the school is not ending. I
Yeah.
mean, you finished a level of schooling
You
and you
see
want to
more things.
advance,
Yeah.
at the expense of your reproductive life. So when
Mm,
you're done, the eggs are no longer there. So you need another level of care to get pregnant. So all of this is possible. For me, it's just tell me how you want to get pregnant.
and you will make it happen.
Yes. Just tell us how you want to get pregnant. We'll make it happen.
I'm sure you have
Just
clients that
how,
will tell
anyhow.
you, I want twins, I want triplets.
Yes.
You have some of them that tell you that, like, you have a control of how many stays.
My daughter once was surfing online and she saw this ecto pregnancy
Mhm.
stuff,
Okay.
and she screenshot it very early in the morning and sent it to me on WhatsApp. You say, "Hey, Dad, what do you think about this?" And I replied her, I say, "Of course, you know what your dad would think. I can't wait for this to happen." So just tell us how you want to get pregnant. You can get pregnant. It's not about culture, about tradition. It's about the end result, about the outcome. The outcome is the baby.
Hmm.
You know, you can go any route to get these babies. You know,
Okay, so hope this answers your question, but it's also good that you know that yes, even with doing IVF, they don't have a power over what stays. So yes, I know you might be thinking you want to just have the children at once, but it's also
the
possible.
at once issue, the at once having them at once is the problem here
Hmm.
now. That's a big problem even for me,
Hmm.
because what do you mean at once? You want to have 4 kids at once, or three or two at once? These
Once.
are actually very dangerous moves to make, because tolerating twin pregnancy is hard enough.
Hmm.
triplet and quadruplet and higher order multiples are in some region of the world considered criminal, because the life of the woman is at jeopardy, and
Yeah.
then have you seen a triplet, a woman carrying triplets sleep before?
Oh goodness,
Go
I
to
can
bed?
imagine.
Oh boy.
Oh
You don't want to
goodness,
know the trouble they go
to go
through.
through.
It's just when they have the babies and the babies are grown and you
Yes, that they are
admire them,
exactly, they are
they go to the
adorable
same
and
class,
admirable.
the same
Everything is
university,
happening
and
same time.
they're just looking glamorous and all of that.
Mm,
But the life of the mother and the
yeah,
number of women who lost everything and almost lose their life or lost
nice
their
in the
life, in
process.
the process, are
Mm,
not being celebrated. And that's the problem
mm,
that the world doesn't know. So
yeah,
yeah, so saying having all of them at once
at
is a big
once.
challenge.
Mm,
Except of course you want to have one, as you're carrying the one or two, then a surrogate
it's
elsewhere is
exactly.
carrying some other for you.
Mm,
That's thinkable. But you
yes,
carrying everything at
at
once,
once. Mm.
it's
It's
something that
it's a
we will
big
need
risk.
to negotiate
Mm.
with respect to your health and safety.
Safety. So it's about your safety. Yes, I
Mhm.
know you want to have the kids at once, but it's about your safety. Okay, so we also have a question. Can someone with azoospermia go for an IUI? There they go
No,
again.
please. There's nothing to debate here. What are you doing? You are with. You want to you want to pump air into the uterine
Oh, that's
cavity.
okay.
Jesus Christ. There are some questions that shouldn't come up. This is one of them. Are you azoospermia mean there is no sperm? Okay,
Exactly.
no, now there's a sense in this.
Okay.
Yes, there's a sense in this. I
Okay.
think I understand the question. Apologies for that laughter.
Sorry about that.
Maybe IUI with a donor sperm.
Okay.
Yes, exactly. In that case, yes. If his wife is fine, the wife is
Yes.
fine, and the tubes are okay, she's ovulating, or you induce ovulation, and then you can do an IUI with a donor sperm.
Mm.
But an azoospermic man doesn't have sperm for IUI.
Mm.
Even if you do testicular sperm extraction, it is not good enough
I
for
do for
IUI,
IUI.
except you're using a donor sperm for the
Mm.
IUI. Then, of course, it's okay to do
To
that.
do that. So hope you
I think it's an
understood
intelligent question.
better. Yes. So well, we really don't know the angle you're asking from, but whichever, we really hope that answers your question. And then we have someone saying, why do I need to do hysteroscopy before IVF treatment? This question keeps coming because they don't seem to
To understand.
understand.
So now, this is actually not a generalized condition that everyone doing IVF will have to have hysteroscopy, but there are what your doctors will see during the evaluation that hysteroscopy becomes necessary. If during your evaluation ultrasound scan there are indications that there are growths in the uterine lining, or
Yeah.
there are scars in the uterine lining,
Mm.
or maybe you've had fibroids surgery one or twice, or you've had D&C, like as is very common in this part of the globe,
Yeah.
D&C. And D&C scrapes the lining of
Mm.
the womb, scrapes the lining of the womb and leaves you with adhesion sometimes. So, or you see lesions in the lining of the womb you don't understand. You want to see with the scope. Heteroscope is a telescope inserted through the vagina into the uterine cavity. So you see the uterine cavity with the HD, high definition camera view.
Mm.
So tiny abnormalities will be seen and corrected, because from this part of the world, we think that one major reason why people don't get pregnant, aside from egg and sperm
No. Yes.
abnormality, is endometrial abnormality.
Okay.
And hysteroscopy would get a lot of those
That.
understood and taken care of.
Mm.
So those are some reasons. If you have recurrent field IVF, for instance, you could just be recommended a
I do
hysteroscopy.
understand.
So there are quite a number of reasons.
Reason.
Yeah.
Well, for this person that asked this question, I'm sure if you flip through a handle, you would see a lot of videos on why you need to have a hysteroscopy
Yeah.
done. I'm sure you'll be able to understand better. But hope Dr. Ken has been able to address your concern on that. So we have a question coming from Bethel Mari. She said, my partner and I are both AS genotype, and we really want to go ahead, but the discouragement from people is overwhelming. What are some possible ways that we can navigate around it without having sick kids? That's more like saying kids with SS
Mhm.
genotype.
Very important question here. We are endemic with sickle cell
Yeah,
abnormalities.
yeah.
We sub-Saharan African. people. So the way to go about it is to do an IVF with pre-implantation genetic diagnosis. That's just the only way you can safely and comfortably avoid
Babies.
SS
Babies.
genotype,
Mm.
you know. So, but then it's very expensive. So, what happened in this case is name Aisha
Bethel.
Bethel.
Yes.
So, your embryos are going to be generated for you, and then we take part of the embryos, the safe part of the embryo to be taken, which
Mm.
is around the periphery, and
Okay.
then subject it to uh, to genetic analysis.
Okay.
That way, you see the genotype of each of the babies.
Babies.
Then
Wow.
you may
Mm.
also see other abnormalities that could be with the baby,
Okay. Mm.
like the trisomies,
Yeah.
monosomies,
Mm.
aneuploidies, and all of that.
Yeah.
Then you can eliminate the bad ones.
Wow. Mm.
I mean, you will refuse to select them for transfer. That is what I mean by
Yes.
eliminating
To
them.
the yes.
Yes, then you select the ones that have the right genotype
Genotype. Mm.
and then transfer into the uterine cavity. So that
Okay.
way, they could have healthy babies, without sickle cell
Sickle
because
cell. Wow.
the accuracy is 99.99999%.
Mm.
So that's the surest way and the most scientific way to go
Way.
about it. The
Wow.
other ways are subject to moral acceptances. Either you or your partner will take a donated gamete from
Mm.
an AA couple
Person. Mm.
from the bank, egg bank or sperm bank. That
Mm.
way, you have a baby that will never be
SS.
SS.
Yeah.
The third way is to just get pregnant casually.
Mm.
Then you do invasive testing like
Mm.
the chorionic villi sampling or
Okay.
the amniocentesis. And then you look at the the genotype of the babies you're carrying. And this is done when the pregnancy is about 10 to 14 weeks.
Okay.
Then you know the genotype. The question
Wow.
now here, or the moral question here, is that
Yes.
what happens if the genotype is SS?
Yes.
Some couple want to go ahead to terminate, in
Mm.
which case you have already formed life and you're terminating it. If your morality permits for that, it's left for you, but then is a moral situation.
Yes. Exactly.
So I feel you don't have to let it get to
To
that
that
point.
point.
Get ready
Yes.
and do the right thing,
Mm.
and do what it's more ethically acceptable.
Acceptable.
That's
Mm.
what I think. Yeah, or you do the maternal blood testing
Testing.
for abnormalities. Then you make
Okay.
your decision. So these are the ways to go about it. In any case, they're all a little bit expensive, but the
Mm.
most expensive is the IVF with
Okay.
pre-implantation genetic diagnosis.
Okay. So we
Yeah.
have another question for you, Dr. Ken. Mariam Dominic. She said, is it possible for a woman with 1 year of no period to opt for rejuvenation? That she needs some clarity.
1 year with no period up for rejuvenation. Now it depends on what the age is.
Is mm,
When what her age is. You could do rejuvenation, but if you're counseled to understand that the chances of having good outcome depends on a whole lot. Those
mm,
with premature ovarian failure, you know, we've done rejuvenation for those in the age of at the age of 27, but they
okay.
have premature ovarian
Ovarian failure.
insufficiency.
Yes.
You know, so the response or the outcome is actually a lot better with them. Because you could just activate a dormant egg.
And
But if you're talking of 1 year without period and you're already 55, 54, the
mm,
chances are a lot lower. But
lower.
of course, you can still do it at that point in time.
Mm,
So it depends on what the age is and what the general picture of this individual is.
yes.
But it can be done at any time.
Okay, so the questions seem to just be popping up. She said, please, doctor, that's from Joy. What causes series of miscarriages at 8 weeks?
Yeah, if you have series of miscarriage at 8 weeks, it's either there problem with the eggs, or problems with the sperms, or problem with the uterine lining.
Mm,
So also metabolic problems.
mm,
The gynecologist or the reproductive physician taking care of this individual will have to rule out some of those things. Those with polycystic ovaries or with thyroid abnormalities or
mm,
abnormal sperms, do you know sperms always escape when we're talking, but
mm.
sperms are now one of the highest cost of miscarriages,
Miscarriages.
especially first trimester miscarriages.
Miscarriages, wow.
And guys
Mm,
should need to check, will need to check their sperms
mm.
a
Increase the
lot.
volume of that mic, please.
Oh, Jesus Christ. What do you have against me, for heaven's sake? It's not the first time you're doing this. Yes, men should actually, the current findings are this that if a woman has miscarriage, I think the man should check himself first before the woman goes to check herself, because uh, more likely it may just be abnormalities with the sperms, because life situation seems to affect sperms more than the eggs.
Wow.
Yeah, I don't know why, but maybe because uh, the testicles are so superficial,
Okay.
they're outside,
Yeah.
and they're exposed a lot to a lot. But
To
the
lot.
ovaries have some covering and they are deeper. That's what I want
Okay.
to think. That's what I want to think. But a lot seems to affect sperms. A lot seems to affect sperms.
Okay.
I remember looking at some sperm pictures recently. You know, men with almost normal count of sperm are not making their their
Pregnant.
partners pregnant. And look at the volume or degree of DNA fragmentation in the sperms. I was like, what's happening here? Stress causes that. Oxidative stress causes that. Exposure to chemicals, hazards of stress. I mean, everything.
Wow.
I see, man, guys, we need to check and freeze those sperms. So in the future we can have
Check and freeze.
giant men. Yes, so it could be bad eggs, could be bad sperms, it could be bad,
Yeah.
both of them could be bad. Then it could be problems with the lining of the womb, it could be diabetes, it could be thyroid disorders, it could
A
be other
lot
metabolic
of
conditions.
conditions
So many things could be responsible.
for that.
So she needs to be evaluated by a gynecologist with some depth and insights into reproductive medicine.
Medicine.
Then it's going to be easy to take care of.
Okay,
If
so
it's beyond 13 weeks, now we talk about weakness of the cervix, as in cervical insufficiency, but we're not there yet.
yeah.
Yeah.
Okay, so Joy, I hope that answers your question. Thank you so much, viewers. Yes, you could keep your questions coming, and we'll definitely attend to them, either through a private chat or some other time. But it's been good having you guys engage us today. Dr. Ken, I don't know. It's been good having you. It's been good having you with us today, and thank you for such an insightful
Nice questions. Thank you so
session.
much.
Yes, viewers, thank you for joining. Until we come your way next time, have a lovely evening. Bye.
Thank you.